The words people in BC may have expected but didn't want to hear.
Late last night, we had a confirmation of a presumptive positive here in BC.
The reason why you have never felt this kind of heat before is because it has never happened before. This is absolutely deadly heat.
The coronavirus has claimed its first victim in BC.
Island Health reacted to yesterday's damning report that found widespread anti-Indigenous racism in BC's healthcare system.
Pounding unprecedented rainfall leads to historic BC flooding, a state of emergency, and parts of the west coast cut off.
The disturbing discovery of an unmarked mass grave at this Kamloops residential school has strengthened calls to search other sites across the country.
The town of Lytton went from this on Tuesday to sheer devastation. That fast-moving fire tore through town, leaving next to nothing in its path.
The last 2 years have been truly just going and nonstop.
I have no frame of reference when people say, you know, when did that happen? And I'm like, I don't know. I think maybe a year ago. I have no recollection. That whole 2 years is like a black box of work, and that's about it.
So you already had sometimes challenged areas, and the ask was we needed to do more, where people are now getting sick and staff are starting to get sick a little bit. So there was certainly, it was hard. It was hard at the start.
It became real, and it became people around us. So it was part of what we were doing. It wasn't just on the news. It wasn't in another part of the country. It was here within our space.
Wave after wave after wave kept coming. And that's when the exhaustion set in. And you could see it within the staff. You could see it within society. You could see it within ourselves.
Come into work and you gotta put on the face, hello, how are you? You know, do your thing every day. Sometimes you don't feel like it. And yeah, it's hard.
It was a really scary time, I think, for everybody who worked in healthcare.
I don't even think any preparation could have had us ready to respond to the heat dome.
And then there was the slides. So living in hope, hope got disconnected from the rest of the world, basically.
You would go through one wave, and then we'd have Delta, and then a heat dome hit, and then we had fires, and then floods are the next. And you know, in plain sight report as far as healthcare's, plus the opioid crisis ongoing, it just seemed to go on and on.
And then when you stop to think what we went through, it's like, holy Jesus, we did that. Like the things we went through, the trauma, like the feelings, all your emotions, like that was a lot. Like I've never in 31 years been through anything like the last 2 years.
The first time I remember hearing about COVID was in early January. My boss and I, Dean, we were in a waiting room, and he looked at me, and I just remember his eyes that day. And he said, "Ali, are we ready?" And it was a Saturday. I was like, "Ready? What do you mean? What are we ready for?" And he said, "It's coming." And at that moment, things shifted for us. So we started preparing and anticipating what could potentially be, never anticipating what it actually became.
What we had seen in other places was that clinicians were getting just as infected as patients and families. And so that worry, that was nothing that we had ever encountered. Sure, a lot of us had been through SARS, others had been through H1N1, but this was something really we had no idea.
My fear personally was that I would get COVID and then my immune system would take off and cause me a serious illness. So I was personally very, very fearful.
When it first started and we first heard the word COVID and big lists came out of what we had to do differently at work. It was like so scary. I figured at this age I'm going to probably die from COVID, and then it made me angry.
And I think all of us were terrified we were going to be the person that would bring COVID into the facility.
I think it was terrifying for everyone because we didn't really know what this would look like and how it would unfold. It was this, unknown disease that seemed to be wreaking havoc worldwide, and we're getting all those terrifying news stories out of Italy and New York. And so, I redid our will in April of 2020 just because I wasn't certain, what to expect.
I have a wife and 3 kids, and when the pandemic first started, we were having to brainstorm of ideas of what would happen if I had to be separated from them for a long period of time. Did I have to go through a separate entrance to de-isolate? Did I even need to stay at a hotel for a period of time? No one really knew yet. And just to prepare for that, which was scary. The thought of leaving my kids for a prolonged period of time and making my wife, for a while, the thought of her being like a single mom, kind of, because I wouldn't be there around for her.
The first COVID patient in Vancouver was admitted to our ICU, and I didn't admit them, but I took over the team. Very soon after that, when I was on call, the second, third, and fourth patient were all admitted to this ICU within 1 hour. And I thought that might be when the ship was going to sink. I remember actually having the thought that maybe this will be the time I don't make it through, to be honest. I remember that. And I remember talking to my brother and saying, this is really bad. I don't know if all of us are going to make it through this. And I remember him saying, he's like, well, your nephews will know that you did a good job. And I remember thinking, I'm still here. What do you mean they will remember? I'm like, oh gosh. So that one hit home a little bit, knowing that, this might get serious and maybe not everyone's going to survive it, that I know. That was pretty heavy.
At the beginning of the pandemic, in this office, looking outside at 7 p.m., because we were still here at work, and seeing the police cars and fire trucks, there must have been 50 of them in a row, and all of the people in the community, outside. It was amazing to see just the support. Sorry. That one was impactful.
I remember feeling immensely emotional at the 7 o'clock cheers. I remember those happening. And I remember feeling seen and recognized.
We remember when the pandemic first hit and everyone was in lockdown and the pans and the pots and people were banging outside. That was incredible for everyone that works in healthcare. It really was. And so it gave us motivation to want to go back to work.
It was actually very heartwarming and inspiring, and really did feel like the society rallied with the healthcare workforce.
And then in September, looking out the same window and seeing thousands of people protest, I think was the lowest part of the past 2 years for me. It almost broke me. It was so sad.
It's disgusting that people would protest in front of a hospital where these people have been working to the point of exhaustion to help everyone they could. It's absolutely disgusting.
They blocked off the hospitals during some of the protests, and just feeling so frustrated. And it kind of butted up against everything that we were trying to do. And it felt like such a betrayal.
See a lot of the staff members, they're in tears, they're crying. They're already burnt out as is, and just another, kick to the gut, right? It was frustrating.
I think some of the hardest interactions, by far, some of the hardest parts of the pandemic were definitely, for me, impacts on families It wasn't just an impact on the family, it was hard for the care providers too, because the care providers who were being told you couldn't let them in, they really faced that not only for the families, but also with the patient or resident they were taking care of at the time. I think that was really hard.
The families couldn't come in. It was hard, and their families was mad. They were mad at us. They were mad at everything. They'd phone and they'd want to talk to them. Like, there was a lot of anger going towards us. We weren't the ones doing any of this, for sure. That was very difficult.
We had one couple that they'd been married for many, many years, and his wife was in the home, not him. And she was the love of his life. He just adored his wife. And she was his world. So every day he would come and spend time with his wife. And then this happened, and he no longer could come and see her. And it took quite a while for him to be able to even come. And how it would happen with them would be, we would put her at the window and he would be on the other side of the window.
For First Nations people, gathering and connecting, ceremony is part of one's culture and one's identity, and it just comes naturally. So asking people to stay apart, not gather, be physically distant, was a big ask.
Being in the long-term care facility, you don't know how much longer some of these residents have. So it could be the last time that they talk to them, and it's through a window.
I felt bad for them. I just felt bad for them. There's nothing I could do about it. I couldn't do anything. You had rules that you had to abide by.
And we were just trying to protect their families. We didn't want, or their loved ones, we didn't want anything to happen to them.
Try not hugging your mom. Really, I mean, that's what it comes down to. You can see them and you can talk to them, but you can't go through the plate of glass to touch them.
You have to try to understand why they're mad at you and know it's not really you. It's not you, it's just a situation.
One of our most basic needs is to be connected to one another, and COVID certainly changed that.
I still hear people talk about when I couldn't see my husband a year ago for that. I think that the impact of that is going to be felt for a while.
In June 2021, the province had the hottest few weeks on record, in which it was noted for 3 days the city of Lytton was the hottest city on the planet, and on the 4th day it caught fire and burned down.
That heat dome period was a fairly dystopian feeling time. We had a number of clients die from heat. And just because people who were isolated and had, medical issues and just were at home with nobody to help them.
I don't even think any preparation could have had us sufficiently ready to respond to the heat dome. We had ambulances going from cardiac arrest to cardiac arrest and literally running out of supplemental oxygen.
In the fall of 2021 is when the floods hit. So multiple cities flooded and affected, the Fraser Valley significantly and clearly flooded, and having to move people around based on cities flooding was yet another environmental event.
And then there was the slides. So living in hope, hope got disconnected from the rest of the world, basically, because the only way out of hope was through helicopter. You couldn't drive. We had 2 nurses stuck in the slide that came down on number 7 highway. So they were there for the night.
It just felt like it couldn't get any worse. It couldn't. Like you'd go through one wave and then we'd have Delta, and then a heat dome hit, and then we had fires, and then floods are the next. And in plain sight report as far as healthcare's, plus the opioid crisis ongoing, it just seemed to go on and on.
PTSD is an eventuality in this job. Not a possibility, it's an eventuality.
It was basically like going into a war right? Like, you're at the front lines, right?
We had 3 of our clinicians go off on stress leave or personal leave. Nursing staff who were getting redeployed to other sectors of the healthcare system. We were working short in an already stressful work environment where, we see a lot of suffering.
I can't deal with seeing people not feeling well.
We've experienced so much death in the last 5 years in this community, and it's really heartbreaking. It's a really difficult thing to deal with as a community, as a team. The toll that it's taking on our community, watching people die is enormous. As I've worked here over the years and seen more and more death, I don't know, I just feel like it's added a dimension to myself that I don't know if it's good or bad, but it's just added a degree of heaviness.
There are certain people that I've looked after that I care deeply for, and I try to do my very best for them. I try to advocate for them.
Well, long-term care facility, when they pass, you do grieve. You do grieve just like their family does.
We'd go to sites, we'd go to places, and, staff are short-staffed in the front line, don't get me wrong, but I met leaders that worked for a month, 2 months without taking a day off, right? They were there every day, working very long hours, trying to just keep everyone safe, trying to keep the residents safe, trying to make sure the staff are safe, working on the floor when they're short so many staff that they have to help out, right?
There were days where we would design something in the morning and then it would change at lunchtime, and then by the evening there was a third message going out. And so I worked 16-hour days for 3.5 months.
There's a component of duty and what we signed up to do as healthcare professionals to be there for our patients when they need us, no matter what.
This has been for such a sustained period of time. So you have to be on, and you have to be, you have to keep up that pace, and you have to stuff your feelings because there's work to do.
It comes down to somebody has to go in and get the job done. And if I don't, there might not be anybody else there that will. Because you don't know how many other people can't make it, can't do it that day. So it's like, okay, I can handle one more day. I can handle one more day. You just kind of keep telling yourself that until one day it's just like, nope, today's not my day.
It's your job, you just do it, right? You don't really, you just know you have to go every day and you have to do it. You have to figure out how to do it and do it nicely. You have to, those are your people, right?
It was my responsibility to be here and supporting people.
So when my kids are in school, whew. Just give myself a minute to be able to bring it back. Whew. I remember distinctly seeing my daughter in her classroom sitting in front of a computer screen and raising her hand to answer a question in class, to be able to contribute to class and be part of it virtually. And in looking and seeing that, I thought to myself, there's a reason why everyone is now sequestered at home and locked at home is because of this. And it's my responsibility within healthcare to be able to contain it, to assist with it, to be able to allow my kids to get back and see their friends and live normal lives and play sports. Seeing that, knowing that it's my responsibility and part of my role within leadership was to be able to see society and get society back safely. That was something that was really changed me and my thinking and made me want to work that much harder to be able to get us back to normal.
There's times you just don't want to get up and you don't want to go back to planning and working. There's no option, there's no choice. You have to, because there's no one else to do it right now. That's the duty. And so I feel all of us, and I mean this is everyone within healthcare, felt that. So I feel that took more, people felt the pressure of the inability to relax emotionally, intellectually, physically, for years took a toll.
Like, take time to look after yourself. I think we just didn't. We just looked after our people, right? That was our goal. That was the end game we felt, but we got lost in it. We got lost and we forgot to look after ourselves during the whole thing. We were looking after other people.
I often feel like a real sense of duty, and it's hard to get away from that, even when, you know, it's impacting your health.
And I think that's often the state of most healthcare providers and leaders in healthcare is I think people who are in healthcare are really coming from a place where they're givers, you know, and people that are doing that often don't actually give back to themselves till the very, very end.
Having sufficient buildup of just trauma and you're no longer who you once were, if you don't take that time to remember who that is and replenish it, then you're not going to be the provider you set out to be, and you can't help the sheer number of people you could have if you did take the time to take care of yourself.
If it's just you and you're dealing with a trauma and maybe you're dealing with other patients on top of that, it's impossible. I mean, it doesn't matter how good you are. And knowing that you've provided poor care, when you hold yourself to a high standard, a normal standard even, it's tough.
There came a point where I definitely recognized within myself the need that I had to change how I was working, because we were all working like that. And like, everyone's like, well, I'm doing fine. Are you doing fine? I'm doing fine. I'm fine. Meanwhile, everyone's saying to each other, we can't sustain this. This pace of work is unsustainable.
And I remember talking to one of my colleagues and realizing that I sounded really burned out, that most of what came out of my mouth was negative. Most of what I was thinking was negative, and I couldn't shake it. And so at that point, I asked for a week off to step away and just spent it at home to regroup and think. But at that time, it was one that I really realized that this is probably the first time I've ever been burned out in my career ever.
I had a moment where I just really lost my cool at home, like early days of the pandemic, where I just was, you know, tired, scared, felt like I had so many competing demands, and it really forced me to look at how I manage my emotions and how I manage stress. And I'm actually super grateful that that came early for me in the pandemic, because it led me to discover meditation, which has been a super useful tool for me in terms of just understanding my emotions and managing my stress level during a very difficult time.
And me, myself, had my first burnout in my career. And I didn't think it was possible. And it was a real good, important lesson for me, because I didn't think I could burn out, to be honest. And then clearly I hit a point where I'm like, I need a break. I need a break, and I'm gonna turn my computer off. And it helped, I haven't had a whole lot of time to kind of just relax and reflect. I don't personally even want to. I don't want to reflect on the last 2 years, because if I do, I'll probably dwell on it too much. And it just might feel a little bit too heavy. I think I might dwell on it when I'm ready.
You forget the things that you went through. You forget the beginning of COVID, like there's so many things between in the last 2 years. Like I forgot about the beginning because it hurts. It's a painful experience. It's painful for everyone. Nobody came out unscathed, like nobody.
Thanks to COVID, I think what we have really learned about the healthcare workforce is that we have to take time for ourselves, and that we have to recognize that there was a lot of pressure on our nurses and doctors and other staff in filling gaps in healthcare where it should have been filled.
It is tough sometimes because you do feel like at times you do a lot of work that goes unnoticed and unappreciated, and perhaps people aren't realizing that the toll that takes.
We deserve to be thanked.
You do deserve to be thanked.
We do. We've done a good job in a hard time.
What would I say to my colleagues if I had a chance? Probably thank you. Thank you for coming in and showing up and doing what we're here to do.
The frontline workers, cooks that cook, we thank you.
My name is Bev Clifton Percival. I'm Gitxsan. I come from the community of Gitxagikla. I want to say thank you, Hatmia, to all the healthcare workers for all the hard work you do for us.
Hi, I'm Tracy from Mission, and there is not a thank you big enough to thank all the healthcare workers that took such incredible care of our son during his liver and kidney transplants and the past 9 years of his journey. So thank you, thank you, thank you.
I'd like to thank all the healthcare workers and public health workers in the province for all the hard work that they've done over the past 2 years.
I'm Ashley, and this is Goose, and we live, work, and play on the traditional and unceded territories of the Musqueam, Squamish, and Tsleil-Waututh people here in Vancouver, and we're thankful for all of the healthcare workers.
Hi, my name is Ivy. I live in Kamloops, and I'm thankful for all the healthcare workers.
Amasa. My name's Janet, and I'd like to thank all healthcare workers for the hard work that they always do.
Thank you to all of our dedicated healthcare workers.
I am thankful for all the healthcare workers in BC and beyond.
Thank you for all the superhero help, and thank you for all the parents' help. I'm thankful for all the healthcare super workers' big help.
Thank you to healthcare workers.
I'd like to thank all the healthcare workers for the wonderful care they gave.
That's Cass in Vancouver saying thank you, healthcare workers.
I'd like to take the opportunity to thank all of the healthcare workers across British Columbia who have been going above and beyond even before the pandemic, but especially so in these last 2 years. Your continued commitment to showing up every single day for your patients and your clients is humbling. So thank you, thank you, thank you.
I just wanted to say a huge thank you to all the healthcare workers.
Thank you, frontline workers. Thank you.
I would like to express my great appreciation for everybody who's continuing to work in healthcare.
Thank you so very, very much.
I just wanted to express my sincere thank you to all of the healthcare workers.
I just want to thank all the healthcare workers that are working around the clock to look after us. Thank you.
And I'm thankful for all the healthcare workers.
Thank you, everybody.
Thank you, thank you, thank you.
I'd like to thank all our healthcare workers for all the hard work that they've done.
Thank you so much for all your hard work to all the healthcare workers.
Thank you to all the healthcare workers. We really appreciate everything you do for us.
Thank you to all the healthcare workers out there for all of the amazing work you do supporting people and families and communities.
Thank you.